So I started utilizing lasers in 2004, primarily to use on athletes to enhance performance and also to help them recover from sports injuries. And then something happened in 2011, which necessity was the mother of invention. My wife had a routine imaging study with an iodine contrast, and this completely upended our lives and changed her life and her health in a really horrible way. We came back from having this procedure done, and we live in Temecula in Southern California. And it was a nice September afternoon, a little breeze coming through. I'm sitting down on the couch. My wife's head is on my lap as we're taking a little afternoon nap. And she wakes up gasping and clutching her chest. And she's panicked and she tells me, something's not right. Something's wrong. You've got to take me to the ER. And I said, what's wrong? What's going on? She said, do you remember that movie, Who Framed Roger Rabbit? I said, yeah, why? She said, do you remember when Roger Rabbit would see Jessica Rabbit? I said, yeah, why? My wife and I talked to each other in movie line, things like this. I said, why are you telling me about this? He said, remember when he would see Jessica Rabbit and his heart would be out of his chest? I said, yeah, why? She said, that's what I feel like my heart is doing right now. It's beating out of my chest and it won't stop. I'm feeling severely dizzy. We've got to go to the ER right now. We finally get her there. And as she's waiting in the waiting room and they take her vitals and her blood pressure is really high. It's like top numbers over 200, bottom numbers over 100, pulses in the 160s. They look at her with being female and they just assume she's having a panic attack. And they tell her, oh, you're just having a panic attack. Now, my wife has a master's in clinical psychology. So she looks at them and says, this is not a panic attack. There's something physiologically wrong. You have to look into this more and figure out what it is. So we now embark on this medical loop of crazy. And at one point it was so bad as my wife is sitting there with her blood pressure and heart rate redlining, worrying about a stroke. The ER doctor is sitting there taking notes. And while she's laying on the table, he's looking up and watching Gilligan's Island and half not paying attention to her. He sighs and he looks at his paper. He says, considering the contrast study you had, you could have a blood clot. And if you do, that could be life-threatening, but we'll run some tests and let you know. And he wheels out of the room. And now my wife is laying there and her eyes pop out of her head. She's, oh my God, he just said life-threatening as I'm already at this level with blood pressure and heart rate. I'm totally freaking out. So she's using all of the techniques she learned in her master's program for psychology to calm herself down, but we're not getting any help. We have doctors coming in saying, we can't figure out what this is. This is just a weird reaction. It's a weird case. We go to see endocrinologists, neurologists, cardiologists. No one can help. My wife, every day, heart is racing, blood pressure's up there. The meds they're giving her aren't really working. Every night she's having severe nightmares. Her hands and feet are sweating like crazy. She's dropping 5 pounds of weight a week and her personality is changing. She tries to watch TV. If there's a quick camera angle, boom, her heart rate would spike up. If she tries to go downstairs, heart rate and blood pressure would spike up. So my wife was literally trapped on the second floor of our house, couldn't come downstairs. I had to bring up food to her to eat. She had trouble showering, all these different things. And at one point, she was 40 at the time, she turns to me and she says, you have to be prepared that I may not make it. So that's when I turned to my old friend, my old classmate, which you guys all know and love, Dr. Datis Kharrazian. We were classmates together. And actually, he was so far ahead of his time, even in school, that I was the first person he ran functional medicine labs on clear back in 1996 when we were students. And he prescribed a functional medicine protocol for me of supplements and other things to help with some issues. So I knew he was like my Obi-Wan Kenobi. Remember when Princess Leia says, help me, Obi-Wan, you're our last and only hope? He was my Obi-Wan Kenobi. So I called up Dr. Kharrazian and I said, Datis, buddy, you got to help me, man. My wife is at a crossroads here and nobody's able to help her. And I explained to him what was going on. And he knew right off the bat what it is. He said, dude, this is easy. She probably had an undiagnosed Hashimoto's reaction here. And that massive iodine triggered her autoimmune assault, tagged up her thyroid for destruction. She dumped a lot of thyroid hormone, got a thyroid storm. And then he's rattling things off. You know how fast he can go? He's telling me, and then this can cross-react with the cerebellum, and that can affect all the different GABA pathways in the brain, and you don't put the brakes on the brain. He's telling me all this stuff. He said, do you follow me? I'm like, no, I don't, but just tell me what to do. So he basically told me how the TPO antibodies were cross-reacting with my wife's brain, and now that whole calming system wasn't functioning anymore. And I said, okay, what do we have to do? So he told me what to do nutritionally, supplementally, get started. But he said, bring her into my office, and let's do an exam on her and see what's going on. So we bring her into the office. He does the exam. We do the lab tests. He does some things and he confirms that she's got this autoimmune assault and she's got an attack against not only the thyroid, but against myelin sheaths as well too, and nerve tissue. And he sits me down, he says, dude, it's not great. This is like a progressive neurodegenerative condition. And here's what your outcomes are to expect. Here's what you do to prolong it. And as I'm sitting there, the light bulb went off in my head. And I thought about some of the patients I had treated with cases that were weird before, like complex regional pain syndrome that we were able to reverse, that is very hard to reverse. And I told Datis, I said, hey, what do you think if I use my laser on my wife to try to support what's going on with her brain? And being the true researcher he is, he says, I don't know, let me go look at some research studies and I'll get back to you. And so shortly after that, he sends me this study through my email. And it said, low-level laser therapy regulates microglial function through SRC-mediated signaling pathways, implications for neurodegenerative diseases. And this was a huge kickoff to getting my wife better. In this study, they used a low-power non-thermal laser. Now, this is a key thing as I'm talking about lasers in this seminar, is I'm talking about non-thermal lasers. I'm talking about lower power. You see this was 64 milliwatts because there are some lasers that are out there that are high wattage. That's not what I used in these cases for my wife or for the other patients that I do functional medicine and functional neurology on. But this particular paper showed that a low dosage of just 20 joules per centimeter squared could attenuate toll-like receptor-mediated pro-inflammatory responses in microglia, and is characterized by downregulation of pro-inflammatory cytokine expression and nitric oxide production. So this is the key thing, is laser really has a very positive impact on inflammatory cytokines. It has a very positive impact too on glial cells. It can shift them from a pro-inflammatory state into an anti-inflammatory state. And the conclusions here is they said, the present study underlines the importance of SRC in suppressing inflammation and enhancing microglial phagocytic function in activated microglia during low-level laser therapy stimulation. And they've identified a new and important neuroprotective signaling pathway that consists of regulation of microglial phagocytosis and inflammation under laser treatment. And their research may prove to provide a feasible therapeutic approach to control the progression of neurodegenerative diseases. So this is what happened with my wife, is we started using the lasers on her. I would use it on her brain and on her thyroid. And here's some studies showing the benefits of laser for thyroid patients. And this is one I recommend you to go look on PubMed. It's known as the Brazil study or the Hoffman study. This researcher followed thyroid patients for 6 years. And this showed that low-level laser therapy was effective in chronic autoimmune thyroiditis. And in here, he noted in these findings that all of the patients in the study had a reduced need for medications, and 47 did not need any medications through the 9-month follow-up. And we saw also a decrease in their TPO antibodies. And that's huge because you think about if these TPO antibodies are cross-reacting with the cerebellar tissue, like Dr. Kharrazian has talked to you about, if we can dampen these things, we can try to also protect the brain from being damaged. And so we started lasering around her thyroid, and this study here shows the benefits you get with lasering near the thyroid or with the thyroid if it's safe to do, if there's no cancer, etc., is you can get increased tissue regeneration. And these studies show they would do ultrasound on the thyroid before laser and after laser, and you can see the thyroid actually regenerate. There's a decreased need for medication. There's increased vascularization. So when they do ultrasounds, like Doppler ultrasounds to check the blood flow, you can see changes in blood flow in the thyroid gland itself. There's an increase in thyroid hormones, a decrease in the TPO antibodies, and an increase in serum TGF-beta. So all these good markers that are there. So let's take a look at this. What does the research say that lasers can do that can impact patients with thyroid or brain dysfunctions and many other conditions? Again, you can decrease those TPO antibodies, so helping to stave off destruction of the thyroid gland and of the cerebellum. This can impact brain function there. You can also increase and stimulate glutathione, which we know Dr. Kharrazian talks about the importance of glutathione and nitric oxide as being something that can take a bullet for autoimmune patients. Glutathione being that powerful antioxidant. When we get laser on a patient's body, they're going to create their own cascade of glutathione. They're also going to stimulate the release of nitric oxide. And particularly, it's going to be like the neuronal and the endothelial, and to have less of an elevation on inducible. So that's really good. So you're not getting the inflammatory type of nitric oxide. These are beneficial for autoimmune patients.